My name is Alyssa Fotopoulos, and I have been a registered nurse since September 2016. That's when I was first licensed, and I have been working as a nurse for almost a year now. I started on a pediatric intensive care unit in February of 2017, so I've been on that unit for almost a year now. Today I'm going to give you some insight on what it's like in a day in the life of a pediatric intensive care unit nurse. To start off, I typically work 3 12-hour shifts a week, of course, unless we have a low census on the unit. Sometimes we do get called off, or we will get floated to different units. I personally get floated to the med-surg unit, or I can get floated to the neonatal ICU. Most of the time we do stay on our own units though. It's very rare that we do have to float, unless needed of course. Or we could occasionally work overtime hours if we have a high census and they need extra nurses to help out. My unit is a pediatric intensive care unit, as I mentioned. It's an inpatient unit. We see children as young as 28 days old all the way up to 17. Sometimes we even see kids older than 17, such as 18, 19, even 20-year-olds, depending on their situation. If they have a history of coming to our unit and we know the child, sometimes we see them past the age of 17. Typically on my unit, we have assignments are never more than a 2-to-1, so 2 patients to 1 nurse. Occasionally, if there's a patient that is in very critical condition, it can be a 1-to-1 where it's just that one nurse that takes care of that one patient for the entire shift. We do see those quite frequently on our unit. The different types of patients that we see anything from post-operative patients, all different types of surgeries. Can be brain surgery, any type of throat surgery, things like that. We see quite a bit of trauma. We're a level 2 trauma center at my hospital. We see a lot of respiratory cases, endocrine cases. We see a lot of pretty much everything. So to start off my day, I would have to say first, when I wake up and get ready, I definitely have to have my coffee on me. I work full-time and I'm also in school right now full-time. So between that and balancing family life at home and making time for all 3 of those things, plus I have pets to take care of, I do get tired, so coffee is essential for me. Next, when I drive into work, I do my best to try to clear my mind. You never know what you're going to see when you walk into the unit that day. It's a 16-bed unit, and like I said, we see all types of cases. So I try to clear my mind, make sure I'm nice and focused on whatever kind of nursing care I'm going to have to provide that day. So when I get on my unit, we have a big whiteboard. It's got all of the patients that are on the unit and a little bit about their diagnosis, and it says what nurse is assigned to them that day. Like I said, we can have up to 2 patients, or you could be in a 1-to-1 assignment. So I'll look up there to see what I have on that list, who I'm assigned to, and then I proceed to look at their electronic health record, just a little overview about what I'm going to be doing that day, what kind of medications I'm going to have to give, what kind of assessments they have ordered, things like that. After we do that, we then proceed to have a huddle. We have a huddle at the beginning of every shift with the charge nurse. Basically, they just tell us any policy updates, any new policies that may be in the process of being put into place, or any subtle reminders of things that maybe some people have been forgetting lately on the unit. After that, we go and we get our report, which is handoff from the nurse from the previous shift. They tell us a little bit, basically all about the patient, history, their status. We go through all the systems, and we just talk about anything that we'd need to know for the following shift that we're about to take on. We do 3 full head-to-toe assessments a shift every 4 hours. Then we do vital signs every hour. So we do keep pretty busy, especially if you have 2 patients. That can definitely you can have your hands full. And in between those assessments, we could also have additional assessments such as neurological assessments if it's a post-op brain surgery, they might want their neurological function tested every hour or every 2 hours. That's very common on our unit, to do that on top of having another patient to take care of as well. If you have a patient that has a Foley catheter, you have to monitor their urine output and empty it every hour. So that's another thing that it's something to do all the time. There's always something to do. Let's see, what else do we do? In between all of that, we pass meds, all different kinds, and got to make sure, just verify it's the right dose and it's for the right patient, of course, and just make sure none of the order was messed up, or always double check. We have to make sure of that. There might be labs that they have ordered that we need to check, blood labs, urine, anything like that. We also do dressing changes, baths, daily weights. That's all things that we do during our shift. We also, at the bed, on my unit, we do bedside procedures such as lumbar punctures. We also do central line placements. We do those all the time at bedside. So if you're planning on doing one of those, you have to make sure you have all the things that the doctors will need, any medicines that they'll need for sedation, if they need additional oxygen, things like that. You have to work with your respiratory therapist that's on the unit to make sure you guys have everything you need for the procedure. We deal with things like intubations at bedside. We do those too. Also, we go on road trips. Occasionally, our patients have to go to CT, the CAT scan, or MRI. We do that. We have to make sure we have all the necessary medications, make sure we have their code sheets for all the emergency medication doses that they might need, all kinds of things like that. And you got to pack them up and take them down. It can be quite a hassle if you don't have help. So that's a couple other things that we do during the day. In between all that, you chart too. You got to keep up with that. It can be pretty busy on the ICU, I'd have to say. But some of the highlights that I have to say that I really have enjoyed over the past year learning this new job would be watching kids come in very, very sick, and then staying on our unit for as long as they need and watching them get better progressively. Usually is rather a slower progression because when they come to us, they are pretty sick. But I've seen a lot of kids get better and either get transferred to the med-surg floor or even get discharged home from the ICU. And it really is an unbelievable feeling watching them heal and knowing that you helped to save their life, honestly. It's an amazing feeling, and it's really what keeps you going on this type of unit, because it can get stressful and it can get hard, and just knowing that those cases where they do get better and they walk out of there, it's an amazing feeling. Something else I would say is getting to know not just the patient but also the families. There are some patients that are on our unit for weeks, sometimes months. So we really do get to know them on a personal level, and making those connections and knowing that patient wants to see you back in their room, saying, "Oh, can I have this nurse today?" Knowing that you're making a difference in their experience on the unit, it really does. It makes a difference in how you feel when you come to work every day. As for the lower sides, or the lows of the job, obviously we do see some rather rough cases on my unit. Sometimes we see what we call NATs, non-accidental traumas, in terms of some form of child abuse, which neurologically or severely injures the child neurologically. They are devastated because of the abuse that they have incurred, and it is really hard to see those types of cases. I've had a few since I've been on my unit. It was a struggle. I won't say that there's not days that you don't go home and you just want to cry in the car ride home, and sometimes you have to, because if you don't let it out, you'll never grow, I guess, and learn how to deal with those cases in the future. It's hard, but knowing that you're there doing everything you can, supporting the family, it's hard, but you have to be the bigger person. You have to be there. You have to be a shoulder for them to cry on, and any questions they may have. You're the nurse. You're the one that's there for them, and knowing that I have grown into a nurse that can be there for them and putting my feelings aside is something that I have really worked on since I've been there. But like I said, it is very hard, especially the ones that come in and you know that they probably aren't going to survive, but you're going to do everything you can to make that their time there as best as you can for that family. I would have to say that even though those negative things are hard to deal with, they do, at my hospital, we have a bereavement committee that helps not only the family, but they're there for every staff member. If they're having problems with dealing with any type of death that occurs, there's a great support system intact. Not only the other nurses and members of the unit, but like I said, there's an actual committee that there's a therapist that any of the staff can talk to at any time if they're having a hard time dealing with the situation at all. And I have to say my hospital does have a really good system in place for the staff in terms of dealing with those low times when things are a little hard. But I would have to say that the good does outweigh the bad. Like I said, it is an honor to go to work every day and help children grow and heal and be better and know that they're going to go home and live the best life that they can live. And we see a lot of patients that come back and visit us, which is amazing to see them so much better. And even after especially the ones that are sometimes there for months, it's amazing to watch them come back to us. Like I said, I've been there for almost a year, so there's been some patients that come back 6, 8, 10 months later, and just to see them so happy and so grateful that that our team cared for them, it really is amazing. That's a little bit of insight on what it's like to be a pediatric intensive care unit nurse. I hope that the information in this video will help you to understand a little bit more about what it's like. And hopefully, if you think you're cut out for it, you will consider working in the field. Like I said, it really is rewarding in the end. I can assure you that. Again, thank you for your time, and have a good one.